Okay, welcome everyone. My name is Nicole Butler. I'm with Fresno Madera Medical Society. We're going to go ahead and get started with today's Telehealth 101, how do you get started during the coronavirus? We've done a couple of these webinars in partnership with the California Medical Association. We felt that this one was a really important webinar to bring to you. Seeing the demand for information on implementing telehealth quickly, we reached out to the California Telehealth Resource Center to bring you the most current information and resources available to assist you during this time, this crazy time. CTRC is the leading source of expertise and comprehensive knowledge and development and operations of telemedicine and telehealth programs. They are nationally recognized as one of the 14 federally designated telehealth resource centers throughout the nation and offer extensive hands-on experience in telemedicine development. Joining us today, we have a couple representatives from CTRC, Kathy Chorba, which is the Executive Director, Rebecca Picasso, which is the Program Director, and Aislinn Taylor, which is the Outreach and Training Coordinator. Before we turn over the screen, just to let you know that everybody will be muted throughout the entire presentation, but you are free to ask questions in the chat section, and we will address those at the end. We'll try and get it through as many as we can. If not, we'll put together some additional Q&A as well as the contact information for CTRC if you want to reach out to them for additional questions. So Rebecca, go ahead and take it away.
Hi everybody, I'm Rebecca Picasso. I'm the Program Director for the California Telehealth Resource Center. And like Nicole said, we are a federally funded telehealth resource center. Our job in everyday life and all day, every day is to promote the adoption and expansion of telehealth in the state of California. And we do that by providing resources and technical assistance and answering the phone and emails and answering your questions. We also do, under normal circumstances, in-person implementation workshops to walk you through the process of implementing a telehealth program from nothing. And so today we are going to talk about the down and dirty, quick, fast way to get telehealth up and running. I want to just let you guys know that we as a resource center work in conjunction with all 14 resource centers, the other 13 resource centers across the country. And where we can, we all share resources. So some of the information that's contained in these slides today, we didn't develop. One of our other resource centers developed. And so we just want you to know that, it's not all our content and we want to give them credit for it. So under normal circumstances, we would recommend that providers, clinics, hospitals, anybody wanting to implement telehealth to do a very thorough planning process. That would include things like needs assessments, reaching out and figuring out the different types of equipment that's there, figuring out what your patient need is, all of that good stuff. However, right now in this public health emergency, healthcare providers are being encouraged and even pushed to use telehealth to see their patients whenever possible. And so this presentation is going to focus solely on web-based video to interact with your patients. It's not going to cover other types of telehealth, such as store and forward, remote patient monitoring, or any other kind of technologies like telemedicine carts or medical peripherals. While these are all excellent and valid options in your telehealth program, right now this is the quickest way to get you started. So the first thing that you want to do, if you haven't already, is you want to determine the need still. And while you're not necessarily going to go through a 5-page needs assessment where you assess everything, you want to think about what it is that you're trying to accomplish. Are you wanting to use, video visits to see initial patients to figure out if that patient should come into the clinic in person? Are you wanting to substitute it for in-person visits, meaning that you don't want patients in your clinic at all whatsoever? Are you going to use it for follow-up? Are you going to use telehealth for patients that are currently already scheduled? Or are you going to use it more of like an urgent care type program? And then you want to also consider, in your telehealth program, do you want patients to initiate telehealth visits to you, as in they use video, they contact you in that manner? Or do you want to utilize it so that the healthcare providers are reaching out to the patients in that manner? There's a bunch of different ways that this can be done. And so those are some of the things that you want to think about, that you want to consider when you're getting started ASAP. So for those that don't know, or those that aren't all that familiar with telehealth, it can be used across so many different specialties. On this list, there are 59. This is not an all-inclusive list. It's just a list to give you an idea of some of the different specialties. Primary care is absolutely one of them. Behavioral health, endocrinology, pediatrics, there's so many, and I won't go through them all, but just to kind of give you an idea of the different types of things you might be able to do over video that you might not have thought about. So, okay, let's talk about this. Software and equipment. What do you really, really need to get started right now? Excuse me. So in general, the Resource Center is always going to recommend that you take a good look at technology and that you do your in-depth research. However, during the current public health emergency, the federal government has also done some relaxing and provided some flexibilities in the types of equipment that you can use. Whereas normally a cell phone would not be acceptable for Medicare, it's currently acceptable for Medicare. So when we go through this and we talk about this, we're going to give you, some general guidance, but it's all just for right now for the COVID-19 pandemic. It won't be in place afterwards. So let's talk about some of the software and the hardware that you can use. So I think my slide's being cut off. I'm so sorry, but these are some of the products. So right now, to get started, really all you need is a desktop with a good quality webcam. HD is better. You could use a tablet, you could use a cell phone, you could use a laptop. You don't need big fancy equipment right this moment to get started. All of these are web-based or have web-based application capabilities, and so all of these would be absolutely applicable. So if you're looking at pricing, just to give you kind of an idea, desktops and laptops, $300, $500, they can go more, right? If you're gonna buy the really, really expensive one. Your PC webcams, so your Logitechs, you're looking at about $75 to start, maybe $150 on the high end, not too bad. If you want to use a tablet and you don't have one, $2 to $7, you kind of get to play around in here, but these are just to give you an idea of pricing. If you already have something like this, you don't need to go out and purchase new equipment. The one thing that I do absolutely want to advise you on is if you are going to use a mobile device, and I don't mean mobile as in cellular, I mean mobile as in I can move it around. Please, please, please use a stand. When you're walking around your office and you're pacing back and forth and you're trying to hold your cell phone up to people and talk, they start to get a little seasick. And so best practice would be to use some kind of stand, some kind of capability to keep it still. So video platforms. I'm going to say again that the Resource Center always, always, always encourages you to use a HIPAA compliant healthcare platform for your video visits. That said, right now during COVID-19, the Office of the Civil Rights has temporarily relaxed its standards. And so what that means is in everyday life, you would not be able to use FaceTime. You would not be able to use Skype. You would not be able to use Facebook Messenger. But right now, those applications are absolutely allowable, and there will be no enforcement action if a provider uses one of these applications in good faith. However, it takes 2 minutes to download a HIPAA compliant platform, just the same as it would for you to utilize one of these non-compliant platforms. So wherever you're able to, we absolutely recommend that you use a HIPAA compliant video platform. Here's some of the examples of platforms that are out there. The Resource Center is absolutely vendor agnostic. So what that means is I'm not going to recommend one of these vendors or another over anybody else. We can just tell you what's out there and who's kind of, maybe some of the big hitters or the most popular ones, but we're not going to be able to tell you, Zoom is best, or video is, you know, absolutely the way to go. I can't tell you any of that, but I can tell you a little bit about these. Zoom tends to be a pretty stable platform across all kinds of internet connections, from very poor cellular connections to, you know, the fastest high-speed broadband you can get. Doxy.me is a platform that is, you know, super easy to use. And so really it just kind of depends on what you're looking for. We can kind of tell you a little bit about what these platforms have to offer, but it's up to you to make the decision on which one to use. Some of them cost more than others. Right now, during COVID-19, a lot of these platforms are offering reduced and or free software access for you. The other thing is, if you have an EHR or a patient portal or a practice management software that already has video embedded into it, you can absolutely use that. And please do. If you're already paying for it, you might as well use it. So let's talk about some practice considerations. One of the biggest things that people are asking right now is consent. How do I get written consent? Here's the great news. In the state of California, written consent is not required. You are required to get verbal or written consent for telehealth services. And if you're a larger practice and you have a general consent to treat that has a little paragraph about telehealth in there, that counts. So there are practices absolutely that say, I want verbal, or I want written, sorry, and I'm always going to want written. Great. You can use a platform like DocuSign that is HIPAA compliant, believe it or not, and you can send those forms to your patients, have them sign electronically, and send it back to you. Or you could just get verbal consent. Another thing to consider is, how are you going to ID the patient? Best practice is to just have them hold up their license, their driver's license or their state issued ID or something like that, to the camera. That way you can absolutely verify that, you know, hey, this is really Sally Smith and not, you know, Sally Joe down the road that's her neighbor that wants to be seen. You could obtain copies of driver's licenses, but, you know, honestly, the easiest way is just to kind of hold their ID up to the camera. Another thing to keep in mind is that you want to have an emergency backup plan, because these patients are not in your clinic and you aren't able to physically help them. If something, God forbid, happens when they're on video, what are you going to do? And so you want to have a backup plan. You want to think about that before you start video visits with your patients. You know, do you call 911? Do you, you know, advise them to go to another healthcare facility? You know, what is your backup plan should something go wrong? And then you also want to make sure that you're screening your patients just a little bit. You want to make sure that they're appropriate to be seen over video. Not every patient is appropriate. And so you want to kind of just do, you know, a little assessment. You know your patients best, and you could probably figure out pretty quickly which ones are best for video visits and which ones aren't. Okay, so let's talk about camera location. So I'm going to play around here for a little bit because I have a couple of different camera options on my phone, or on my computer, sorry. And so what I want to talk to you about is creating the illusion of eye contact. So your camera placement is really important to make it look like you're connecting with your patient, even if you're not looking at your camera. Right now, my camera, I'm using an external camera. My camera is directly centered in my laptop, and I'm a pretty decent distance from where my camera is, and I'm assuming that it probably looks like I'm giving you eye contact. However, if I just move my camera 6 inches to the right over here and I look at my screen as I'm typing, I'm no longer giving you eye contact. So now it looks like I'm not even looking at you, right? Because I'm not. So if I just move my camera back and I put my camera right here, even though I'm not looking directly at my camera right now, I'm actually looking at, you know, my taskbar, the bottom of my slides. It pretty much looks like I'm watching you. Oh, that sounded bad. I'm not watching you, giving you eye contact. So this little button up here that we just circled in red, this is you know, an example of your camera on your laptop, for example. So you want to make sure that your camera is kind of right about here. on your physical person, that it's at about this level. And that will kind of start to give you the illusion of eye contact. This doctor here in the picture, he's not actually looking at his camera, he's actually looking at his screen. You know, maybe he's talking to the patient, because you're not gonna be able to see your patient if you're staring at the little hole for the camera. So the other thing that you can also try is backing yourself up from the camera just a little bit. You don't want to be too far away, but if you back yourself up from the camera just a little bit, sometimes it can give that illusion of eye contact. And then the last thing that I want to talk about is the lower the camera, raise the image. So I'm going to, again, move my webcam here for you. I'm going to move it over to the left this time, and I'm going to put it down here. That is a horrible, horrible placement for your camera. You do not want to be doing this back and forth. And so if you notice that if I raise my camera up, even though it's over to the left side and I'm currently holding it, it changes my image. And so we kind of always recommend that you don't necessarily do your video visits with your camera way down here. That just doesn't look very professional, very appropriate. But if you do, I'm going to move my camera back. Sorry, guys. But if you do have your camera, just, you know, again, kind of here level, it really does give that illusion that you are, you know, interacting and giving eye contact. So let's talk about your backgrounds, framing your backgrounds. So again, your camera should be kind of head level, right? You want to fill up the frame. So similar to how my video looks right now. So you want to have most of your person available in the frame. What you don't want to do is you don't want to have your, like this. You don't want to just be a floating head. Alternatively, you also don't want, you know, people seeing up your nose. So when you go from the bottom up, people can see up your nose. You don't want that. So you kind of want your camera directly in front of you, and you want to make sure that the top half of your body is within the frame. If you're a hand talker, I'm a hand talker. You want to back yourself up a little bit and make sure that your hands are in the frame. And the reason for that is because if you're up close like this and you're moving your hands around, your patients don't see that, and they're like, what are they scratching? Like, what are they doing? So if you're a hand talker, just back up just a little bit, and frame yourself so that the patient can see your hands when you're talking. You want to avoid intrusive backgrounds. My background, this is a knockoff Japanese screen. Probably not the best background for you to have when you are seeing your patients. You want something a little less busy where you can. You know, whether it's just your office and the walls, maybe you've got some pictures or your degrees on the walls, that's okay. You just don't want something super busy. You know, don't put a tie-dye rug back behind you. And you want to avoid backlighting. So let's talk about lighting. So standard workplace lighting is often good enough, but guess what? Most of us are no longer in our offices. We're working from home. We're not in our clinics. We're not in our normal office. And so we all have, you know, weird, funny lighting situations. So the general principle here is to use bright diffused light from the front of you. You don't want your light source coming from back there. You want your light source coming from in front of you. So I'm going to show you a couple of things here that you can do. So I have an extra light. My extra light I stole from my teenager. I'm going to be honest. It's a ring light that she uses for selfies, but it works really, really well. And I'll just pull it down here a little bit so you can see. I know it's going to get kind of funny, but it's just a little ring light. It was like 10 bucks on Amazon. And this ring light makes, when it's properly placed, because now I moved it, this ring light makes a huge, huge difference in my lighting. So I also have an overhead light up right now. And if I turn this ring light off, my lighting is actually significantly different. That overhead light is too bright, it's too much, and then it's creating shadows. I also have a window right here, and even though my blinds are closed, that creates a light source. I do have a small lamp on my table, so I'll show you what happens if I turn on my lamp. I get a little bit more light, but I'm all shadowed over here, and it's not enough light. And so this little lamp that I have right here is probably not enough. But if I turn this little ring light back on, I have all kinds of light and I'm perfectly lit up and the patients can see me perfectly fine. I'm not, trying to push ring lights, guys. I'm just giving you an idea of what it's like when you have the proper lighting. So if you do have the options, put a lamp or 2 lamps, on either side of your workspace, so that when you're on video, you're creating light, but it's not direct light. You don't want to use something that's going to look like a spotlight. You don't want to look like you're being interrogated. So you want to avoid kind of harsh lights if possible. You want to avoid any glossy surfaces because those create reflections. You want to, again, avoid any unbalanced light or point sources, so that this would be unbalanced light right here. This is a good example of that. Let me turn that back on. And point sources would be, you don't want to do the spotlight thing. Lamps can throw shadows, so that's something to keep in mind. So again, just a quick demonstration here. If I turn on my lamp, it's not throwing shadows at me, but this whole side of my face is shadowed. And this is all glossy, and yeah, let's turn that off. So you want to think about those things when you're trying to do video. You don't have to spend a lot of money. You probably have something around the house that can do that for you. But you want to avoid, again, being backlit. So that's lighting from behind coming this way towards your camera. You don't want to do that. You'll end up looking like the little shadow doc we have here as an example. And if you have windows, you want to try to not have them behind you. So I have a window here, it's off to the side of me, but if I were to turn around, then the window would be behind me and it would be backlighting me. You can have the window in front of you, you can have the window to the side of you. If you're getting too much light source from your windows, absolutely close the blinds, do whatever you need to do, but definitely don't want them back behind you. And again, you want to try to avoid any kind of bright, like if you have, high gloss walls and you've got big, LED lights shining on you, you're probably getting some glare and reflection from behind you. So just some things to think about with lighting. So privacy and security. So normally in an office space, whether that be, clinic, hospital, your own private practice office, you want to make sure that your work area has sufficient privacy. You don't want people walking through the space. You don't want people, standing off camera overhearing something. You just kind of want to make sure that you are in a private and secure location. Alternatively, if you look at the picture here on the right, this is a colleague of ours from another TRC who's in her office, but her office has a giant window right behind her that's not covered. And so you can kind of see her coworker peeking in there. When you're working from home, from your home office, these things might not necessarily be so much of a consideration, but you don't want to be doing these appointments in the kitchen with your kids running around and dogs barking. And, you want to be behind closed doors, just as if you would in your normal practice. So let's talk about sound. So my sound right now is probably not that great. I am in an empty room that I'm getting ready to redecorate, and I'm not using an external mic, and that's probably a bad idea. But just some things to consider with sound is, if you do use an external mic, like the one that the gentleman in the picture is wearing, they tend to have noise canceling capabilities. And if they have noise canceling capabilities, then that means you won't hear the echoes. You won't hear, the dogs barking, across the street or whatnot. So external mics are definitely a great thing, but you also want to check and make sure that they're not too intrusive, meaning that, it's not this giant, like Dre's Beats, big old headphones on your head that make you look a little bit alien-esque. If you get feedback from your mics, it's usually because there are 2 audio connections happening in the same room. And typically what we see is that someone has logged into Zoom, they have their audio on for Zoom, and they've dialed in on the phone, and both mics are unmuted. That's typically how we start seeing feedback. So make sure that if you're going to use Zoom, if you choose computer audio, that you don't dial in on the phone, and vice versa. If you choose to use Zoom, you could dial in on the phone, but make sure you don't choose computer audio or that your computer audio is muted. If you hear an echo, the one that's causing the problem can't hear the echo. So if you're hearing the echo, it's probably the other person. And a pro tip, the mute button is your friend. So, in this world right now, as it is during this pandemic, if you're working from home, your kids might be home, your spouse might be home, your dogs might be barking, it's absolutely okay if you need to excuse yourself and place yourself on mute, go take care of whatever it is you need to take care of and come right back. I wouldn't recommend that you do that on a consistent basis, but mute is your friend. Don't leave yourself unmuted if you're going to go, deal with other business that's happening outside of your door. Make sure you use your mute button because you don't want your patients hearing that either. So let's talk about a little bit of universal video etiquette. So everybody in the room should be on the screen or should come on the screen momentarily and introduce themselves. So if you are still in an office location and you have somebody sitting in, one of your docs in the practice is like, hey, I want to see how this goes. I want to watch what you do. Just make sure that you introduce that doc and that you let your patient know, hey, he's going to be in the room here. He might be off camera. He's going to be over off to the left or to the right, but he's going to be in the room with me. And vice versa for your patients. You want to make sure that your patients are letting you know if there's someone else in the room. You don't have any control over that, but you want to ask them, hey, are we alone? Is there anyone else in the room? If so, could you introduce them to me? I don't mind if they stay. Or, hey, I do mind if they stay. Could we ask them politely to leave the room? However it is you want to handle that, but you want to make sure that on the patient end as well, you want to know if there's somebody else in the room. Okay, so let's talk about internet bandwidth considerations. I already saw it happen once to me. So successful video visits require that you have adequate bandwidth to your home and to the device that you're using. So what does that mean? That means that right now, if you're at home, most people have enough broadband or have a decent enough internet connection that they could do a video conference. But right now, everybody's home. Kids are home, spouses are home, others are home, and everybody's using a device. And guess what? Everybody's using internet. And that's more devices probably at one time than you're used to. And those devices take up bandwidth. And so what we would suggest is that if you're able to, ask them, hey, could you quit playing Minecraft for, an hour, half hour, whatever, because I need to do a video call and I want to make sure that I have the best broadband available. If you have multiple tabs open, let's say you're a Google person like me and you've got 80 tabs open. Every one of those 80 tabs is taking up bandwidth and is using up internet space. And so you want to just close all those. You want to close all unnecessary programs. You want to ask, others in your household, if you're working from home, hey, could you not stream, Frozen 2? I keep using kid references, sorry. But you just want to make sure that you have as much bandwidth as you possibly can in your home by reducing the unnecessary usage at that time. In the clinic setting, probably not so much of an issue, but you do want to make sure though that if you are in a clinic or a hospital or your own private practice, if you're using an EMR, those take up quite a bit of internet broadband, and you want to make sure that you have enough left that if you're doing a video visit, it's not going to get all choppy and it's not going to drop. So it does kind of apply both places. So let's talk about a couple of best practices here. So everyone should be comfortable using the equipment. So that means if you've never used video conferencing software or equipment before, you might want to familiarize yourself with how it works. If I need to share patient education information with a patient and I want to share my screen to do it, how do I do that? Do I know how to do it before we're on the video? You want to use live video if possible in low risk situations to help normalize it for you and your patients. So, if your patient has pink eye, hey, that might be a great time to try a video. You could probably diagnose pink eye over video, and it's a pretty low risk situation. And you want to practice mock encounters. Get your family involved, get your colleagues involved, and say, hey, I'm going to start doing video with my patients. Would you mind testing with me a couple of times just to see how it works? It's a great idea to do that before you start seeing patients. So some tips for success. If possible, create a pre-test call with your patients. A lot of times outside of COVID-19, this is kind of done by like front office staff or MAs or super users, people that really understand the software and can help the patient learn what's happening. If you don't have that person or that person's not able to do a pre-test call with your patients, then you could set that up, absolutely. There's no reason. It takes 2-3 minutes to just make sure that everybody can see each other and everybody can hear each other. If you can't see each other, somebody probably hasn't turned on their camera or probably hasn't allowed the software to utilize their camera. You know how Windows pops up every once in a while that this, such and such software wants to use your camera. You want to make sure they click yes. Same thing with their mic. They want to click yes. Check to be sure that audio and video, again, aren't muted on either end. If the connection's not great, if it's telling you you have an unstable internet connection, try limiting what else is happening around you, what other devices are being used on your internet connection, close your browsers, all that good stuff. Help the patient become more comfortable with the experience. Keep it simple. And if you're familiar with the technology and you're comfortable walking them through that visit, if they're a little hesitant, then that makes it a little easier for them, and that goes a long way with them. Also, have a backup plan if your technology fails. Can the call be moved to telephone? Does the patient need to go in and be seen in person if you can't reconnect? Who's going to call the patient if you guys can't connect again? Is it going to be you? Is it going to be, front office staff? Who's it going to be? So make sure that you already have a backup plan for that. And most of all, relax. You're seeing your patients over video, but it's no different than if you're seeing them in person. You're still having a relationship with that patient. It's just that the more relaxed you are, the more relaxed they are. Even if you're not relaxed, try to make it look like you're relaxed. And then, one of the biggest things that we say a lot at all of the resource centers is that if a patient or a provider has one bad experience, it's going to take them about 10 good experiences to really regain that trust. So as much as you possibly can, you want to make sure that that patient and yourself have a good experience using the technology. So some direct-to-consumer considerations, just to keep in mind. When you're doing this and the patient is at home, you lose any physical control of the patient. You're also relying on their equipment and their network, and you have no idea how that's going to go. And for safety reasons, you may need to verify the patient's location. You might just want to ask them, hey, are you at home today? Or, hey, you're in your car, what's going on? And see if you can try to get that, just for safety reasons. Again, and it depends on what you're doing. You may not need to know where the patient is located, but if something happens, you want to know where to send safety personnel to. There's no one correct solution to these risks, and it may be impossible to provide appropriate treatment in some cases, and that's going to be up to you. That's your clinical judgment to figure out if you feel like this is appropriate. Building rapport. Talk normally. Talk as if that patient is directly in front of you. Make sure you look at the patient. Again, that's where that little eye contact trick comes in. So look at them as much as you possibly can. Don't just be over here typing on your other screen with EMR and you're not really looking at them. Patients don't really enjoy that. So as much as possible, look back and stop what you're doing for a second over here and talk to them. Use gestures. Be animated. If you normally are a hand talker, be a hand talker. It's great. Just as much as possible, make it normal, make it like, we're still, have this relationship. We're still here together. We just have to do it this way. It should be as normal as possible. Some marketing considerations. So how do I tell my patients that I'm doing this? So consider how you would normally market to your patients. Would it be social media? Would it be emails? Would it be website infographics? Would it be videos? And consider when you do put something up, no matter what platform you put it up on, that it be in plain language, and that it's easy for the patient to understand the process. So on our website, we have linked an amazing video. It's about 6 minutes long. It's from the Department of Health in the state of Hawaii. And they put together kind of a cartoon-esque patient-facing education video that walks a patient through what to expect from a telehealth visit. It covers in the clinic telehealth visits, it covers in the home telehealth visits, and it covers some stuff on COVID-19. It's a really great little video. Consider having something like that. Our partner clinic, when I say partner, the clinic that we work with, I guess is what I should say, Borrego Health has put up a little web page on their website detailing for patients, what's telehealth, why would I use it, does it cost me anything, and how do I schedule it? And then they've also kind of included a little, what do I do if I get disconnected? So these are just some of the ideas, for you to kind of educate your patients on what is telehealth, why are we using it, and how do I do it? Reimbursement. I know you're all thinking it. I know you're thinking, how do I get paid for this right now? And so unfortunately for you, I'm going to breeze over it a little bit, but here's why. So in the state of California, telehealth is pretty darn open. We've had laws on the books since 1996 allowing for telemedicine and telehealth. Anything that can be done in person can be done over video and is treated the same. It actually says that in our law. It's really great. We have, under normal circumstances outside of COVID-19, we have a telehealth reimbursement guide for California. That reimbursement guide covers the normal policies for CMS, so Medicare, for DHCS, so Medi-Cal, and for some of the managed care plans in the state. Things are changing so very rapidly, sometimes hourly, on the policy and reimbursement side, that we are not able to update the guide as often as we would like to right now. So we have created, on our reimbursement page, we've created a COVID-19 reimbursement update section. So that is where we're keeping all of the information that we can about COVID-19 and reimbursement. You can go and you can see these pages, review the information for yourself. Alternatively, you can call us. I will be happy to answer questions. You can email us. You can use the contact us form. You can do all kinds of things to get in touch with us, and I'll be happy to walk you through your questions. Right now, during COVID-19, it's almost a free-for-all. I hate to say that, but it kind of is. A lot of the payers, a lot of the managed care and commercial payers are saying, just bill me. We'll figure it out later. I'm not going to deny you, just bill me. So as long as you're a contracted provider for in-person services with that payer, you should be able to bill them for telehealth services and not get denied. That said, you should always check with your plan to be sure. Some of them have certain ways they want you to bill. Some of them want you to use place of service code 02, which is telehealth specific. Some of them want you to use modifier 95, which is also live video telehealth. Some of them don't. Some of them say just bill me as if you would for in-person. So it's really up to you to check with your plans. We have linked some of the plans that we're getting information from on their COVID-19 response on this page. But there is reimbursement available. There may be some small caveats, but for the most part, right now, there's reimbursement available pretty much everywhere. And that's it for me, and I'm going to turn it over to my colleague, Kathy Chorba.
All right. Hey, thank you, Rebecca. That's a lot of useful information, and especially timely right now. So where does everybody go to learn a little bit more about telehealth, or to perhaps take a deeper dive? Because yes, there will be telehealth after COVID-19. It'll just look a little bit different. So let me walk you through a few of the resources that are available to you right now. As Rebecca mentioned earlier, the Telehealth Resource Center the California Telehealth Resource Center is part of a national consortium of telehealth resource centers. And like Rebecca said, there are 14 of us. We're all across the United States, and it includes two national centers, one for policy and one also for technology. Together, we all work as one big cohesive group to develop a lot of resources that are applicable nationwide, and we put those on the national website, which is the telehealthresourcecenter.org. And on that website, you'll be able to find a number of fact sheets that range everything from what is telehealth to how do you develop a business plan, things that talk about HIPAA and patient forward pieces of information and information that applies to providers. So there's a lot of resources and fact sheets that you can pull down immediately from the national website. But there's also more, right? There are toolkits and guidelines and bibliographies for the more academic type of person. But also there is a webinar series that's offered once a month, every third Thursday from 11 to 12 p.m. And it talks about the most recent telehealth topics. It could be a clinician giving a presentation, it could be a technology talk or an operations talk. But if you can't dial in every third Thursday of the month, don't worry. We also record these so that they're available for download on demand. And you can also go back a year or two and find the topic that you want to learn a little bit more about and to watch that webinar. Every telehealth resource center has its own website, because we not only do we contribute to the national resource center website, but we also have our own website that talks about what's most applicable in our own state or our own region. So the California Telehealth Resource Center has our website at CalTRC.org. Lots of information there, but I'd like to direct you to, on the right side of the screen, you'll find a listing of the resources that we do have available, like for a needs assessment, different samples of staff roles and job descriptions, and things you need to think about when you're developing partner relationships and contract modeling and billing guidelines and financial guidelines and overcoming some of the implementation barriers. But one thing that we'd like to also feature is at the bottom, the right-hand side of your screen at the bottom are the new telehealth coordinator online curriculum modules that we have available. And we keep adding more and more modules, and those are free to everyone. As Rebecca mentioned earlier, we are HRSA funded. And so everything that we develop is there for you absolutely for free. And all of our resources and all of our technical assistance, please feel free to take advantage of that. And on the left-hand side, you'll see a picture that says the resources for COVID-19 and telehealth. We did design a special page just for that. So as Rebecca showed the billing guidelines for COVID-19, there are also more resources. Some of the video that Rebecca talked about that talks about patient education, feel free to go in there, click in there, grab the YouTube URL, and then you're able to send that to your patients, even attach it to your own website if you'd like, so that you can have something that will help you in educating your patients about what is telehealth. One of the most popular downloads right now, of course, is the workflow for conducting a virtual visit. So that's something that you might want to take a look at. Again, we try to create these very, very agnostic, very general. So if you take this workflow, you can be able to at least not reinvent the wheel, but you can take something that's already been developed and customize it for yourself. But at least this is already in place for you to take a peek at. So basically, the key takeaways are telehealth has always been a rapidly expanding field, but no more than the last 20 days, right? So telehealth has changed completely in the month of March, and it'll probably change completely again in July and August of this year. So let's always know that we need to be nimble, and we need to keep an eye on the policy and how things are going. Connect with us, give us an email, give us a telephone call, visit our website, attend our conferences and events when we're able to attend conferences again. Take a look at the resources that we have, not only on our website, but go out to the national website and take a look at those toolkits and resources. And then if you're a super DIY type of person, you can go into each and every one of the Telehealth Resource Center websites and take a peek at what they have. We all try to share resources, but there are times where there are some of the resource centers have unique tools that may speak more to what your needs are. So always feel free to contact us at any time. We're here for you. We're federally funded. It's our job. So with that, I will open this up to the Q&A feature. And thank you so much for being with us and taking your time out of your day to listen to this webinar.